what are the treatments that improve mental health, and do they work?
Yeah, well, this is where I think the community mental health um, treatments and programs come into play. Um, you know, when we talk about the group of people who become chronically homeless, the the best program that has a track record that's effective is assertive community treatment. Now, assertive community treatment it's a wraparound service. It's multidisciplinary. It was initially created to help people leave psychiatric institutions. It was part of the deinstitutionalization movement. But it's now a standard part of Housing First. It's the support that's provided, is particularly for people with a high level of needs, is assertive community treatment, and so it's effective. There's no question about it. It's community support. It's kind of rehab based, but it's working with people to set their goals. It's making sure they're getting the proper health services. Not only mental health services, but also physical health services. And then the other one that's also out of community mental health that's very relevant is called intensive case management. And this is where instead of it wraparound and a team approach, it's a program where it's a group of case managers who carry a group of clients, or in the case of Housing First, a group of tenants, they would be kind of almost the primary support. There might be a secondary person assigned, but typically with case management, people are linked to between a tenant or a client and a case manager. Again, that's an effective form of intervention, including, in fact, even before Housing First came on stream, those two programs, assertive community treatment and intensive case management, in the research showed that they were effective in helping people leave homelessness. But the reason the outcomes, I think, are so much better with Housing First, and when I say so much better, I mean there are programs in Housing First that are reaching 85–90% of ending people's chronic homelessness. I mean, if you look in medicine, if we looked at treatments, in medicine, if you had something that was that effective, that would be everywhere. So that's why it's a little puzzling that we haven't done more of this, and particularly in Canada. But what I'm saying is, when you add assertive community treatment and intensive case management in a Housing First program that includes the rent supplements to help people, go out and look for housing and find housing that's suitable for them, that really bumps up the outcomes on approaches that were already effective.